Well, a decision by the Andhra Pradesh government on allowing people who are Ayurveda doctors basically to conduct surgeries has raised a lot of eyebrows. Andhra Pradesh government has sparked a big national debate on surgery and safety and who's really qualified to hold the scalpel. The state has now approved a policy allowing postgraduate Ayurvedic doctors to independently perform certain surgical procedures. The move has drawn sharp opposition and criticism from the Indian Medical Association. In fact, questions now being raised on who is allowed to perform a surgery, what level of training is enough to perform a surgery, and can different systems of medicine overlap without putting patients at risk. This is a big move indeed. Under the policy cleared on December 23rd by the Andhra Pradesh Health Minister, Satya Kumar Yadav, Ayurvedic postgraduates trained in Shalya and Shalakya Tantra can perform 58 procedures, 39 general surgical procedures and 19 related to ENT and eye care. The state government says this is not new. It argues that central regulations already recognize surgical training within Ayurveda postgraduate courses, so why not allow them? But the IMA has strongly disapproved. It says surgery needs deep training in modern anatomy, anesthesia, emergency care, post-operative management, training that according to them only comes through the MBBS-MS or MCH route. The association is also warning against mixopathy, blending medical systems without equal standards, which it says could dilute accountability and endanger patients. Now, adding to the uncertainty here, related rules are still pending before the Supreme Court of India. So, this is no longer just about Andhra Pradesh, it's about the future of India's healthcare system. If surgery goes wrong, then who's responsible? With Andhra Pradesh government now allowing Ayurveda doctors to perform surgeries, will they take responsibility if a surgery goes haywire? Dr. Dilip Bhanushali, the immediate past president of the IMA, joining us live. Also Dr. Mukesh Goyal, senior consultant cardiologist, surgery, heart and lung transplant, Indraprastha Apollo Hospital, and Dr. Prasanna Narasimha Rao, director, SDM, Institute of Ayurveda, Karnataka. Thanks very much, all of you. Let me bring in first Dr. Prasanna Narasimha, as you're well versed with Ayurveda. Sir, do you believe that Ayurvedic doctors can perform surgeries? Do you welcome this directive by the Andhra government?
Yeah, I welcome this decision of government of Andhra Pradesh. And Ayurveda, basically it has 8 branches, and among them the specialty of Shalya Tantra, that's called general surgery. It was introduced way back around 5,000 years back. And this is right from the Vedic time. There was 8 branches of Ayurveda, and one among them is Shalya Tantra. If you transcript it, it is the general surgery.
So you're saying that Ayurvedic doctors can, perform full-fledged surgeries just like allopathy? That's the training given in the Ayurvedic course?
See, Ayurveda has 5.5 years graduation course and 3 years post-graduation course in the different specialities. Previously, it was 22 disciplines. At present, it is 18 disciplines. One among that discipline specialty is Shalya Tantra and Shalakya Tantra and Prasuti Tantra, where MS Ayurveda post-graduation degree is awarded by the universities. And this is gazetted by the government of India way back in 1970. Yeah, 1970, the council has formed. And from that onwards, the practice is ongoing.
Saying that this is just about time that this practice be allowed, because anyway it's been going on in India even before independence. So now that Ayurveda is modernized and there are more intense trainings to Ayurveda doctors, they should be allowed to also perform surgeries. I don't know what the real difference is. Maybe our doctors on the panel here, Dr. Mukesh Goyal, could give us a little more clarity. Dr. Mukesh Goyal, Ayurveda doctors now to be performing about 58 surgeries. It's a limited amount of surgeries that they can perform, but still IMA has heavily opposed it, saying that there's a lot of post-surgery care, anesthesia involved, and it's quite in-depth in that sense when you talk about the field of medicine, which Ayurveda doesn't really fully delve into like allopathy does. MBBS course is what's mandatory. Ayurveda, graduates cannot perform such surgeries. Are you also of that opinion?
So, Nabila, first of all, what I think that if a postgraduate Ayurvedic doctor, he is trained in certain surgical procedures, and the training is exhaustive, and it is done in a setup where it is clearly displayed that this is a Ayurvedic Chikitsa center, and these are the surgeries permitted, and these are the surgeries which are performed here. So I don't think there is any problem with that. Second, if the same laws of medical negligence, criminal negligence, and to address those negligence, the same law frame is there. So I think they can go ahead and do it.
That was an unexpected answer. You're saying that they can go ahead and do it, Dr. Dilip, or do you also believe the same? Can they go ahead and do it?
Yeah, Namaskar. Good evening, Nabila. This integrated course for the government is planning is unacceptable. IMA has been fighting for this, and IMA will fight for this because this is not the scientific way of doing it. So to become a surgeon, it takes almost 10 years. 5 years, 10.5 years of MBBS, then 3 years of surgical course, where they are trained for specific field of surgery. They know what the indication of surgery, the post-operative care, the anesthetic care, the drugs what are given. And so it takes almost 10 years for a surgeon to practice. Now, if you are seeing what AP government has given that in 5.5 years going to give 50 surgeries to be done, this really is a total mockery.
What is the minimum surgical training that is required, that is non-negotiable before anyone's allowed to operate?
First of all, why do you want to mix? See, Ayurveda is a different science for thousands
Correct.
of years. Why can't they maintain the purity of it? Why do you want to mix it with modern medicine? That's our basic question. Why can't they put Ayurveda in its pure form? Let them practice. But you know it, 98% of Ayurvedic doctors prescribe allopathic medicines. Why can't they prescribe their own medicine? And do you think this politician will go to the Ayurveda surgeon to get operated?
Dr. Prasanna, could you tell us in Ayurveda, in the Ayurvedic course of the postgraduate course or the 5 years of studying that they do to become an Ayurvedic doctor, does it also objectively, compare with the MS or MCH in terms of hours in the OT or exposure to complications or even emergency handling?
Madam Nabila, I think I am very sorry that Dr. Dilip does not have the information regarding the Ayurveda courses. The Ayurveda courses has 5.5 years undergraduation course, and after that they have post-graduation 3 years intensive training in different disciplines. I told is one of the discipline is Shalya Tantra, where surgical practice are practiced, taught and trained. And same way we have I and ENT, that is called Shalakya Tantra, and OBG, that is Prasuti and Sri Roga. And these practices they can do only after post-graduation. Undergraduation they can't do it. And after that they have even the fellowship programs, as he said, 10 years minimum is required. I feel even in modern medicine, it is after 8.5 years, means 5.5 years degree course and 3 years post-graduation course. I have been trained in Banaras Hindu University. After 5.5 years course, by the national entrance test, I have been selected for post-graduation. I stood third place in the national test. And after that, we have intensive training program, including anatomy, physiology, biochemistry, pharmacology, and even medicine also the part of the subject, but the surgery is the main course where we are intensely trained in that course. We means Ayurveda
No, but
graduates.
when you say, I just educate me, sir, as someone who does not really understand how Ayurveda can deal with real surgical complications. Okay? Is it possible? Do you use the same equipment? It's a different science altogether, like Dr. Dilip also mentioned, and like we know, you know, we are trained to believe. People by and large are trained to believe that Ayurveda is alternative science. It's an alternative option, not primary. So if there is a complication, if there's bleeding, there's anesthesia, shock, organ damage, is an Ayurveda doctor equipped and trained to handle that?
Yes, madam.
Okay.
You see, I'm very sorry to say that our no experts, so-called experts, are not knowing the background of the science. Ayurveda is the science which has contributed Shalya Tantra, that is the surgical discipline, to whole world. When world was sleeping, India has contributed surgical discipline. Even the present allopathy doctors, the modern surgeons, they consider Sushruta as father of surgery. Why they consider the father of surgery? He has done that surgery. Same way from 1970 onwards, under IMCC Act, CCIM Act has been developed, and from that onwards, the collegiate education has started, and this post-graduation, after graduation, 3 years courses run, and they have been trained, taught and trained. For your information, WHO has published the benchmark of practice, and in the benchmark of practice of Ayurveda, even allopathy doctors are trained for Ayurveda medicine for 2,500 hours training. So this is in practice in all over the globe. I hope.
But Dr. Dilip
should
denies
accept
it. Dr. Dilip denies it. Dr. Dilip?
Absolutely untrue, Adam. Because we have been practicing for ages now. We were never trained with Ayurveda.
Dr.
Now,
Mukesh, were you trained with Ayurveda?
Let me ask the learned friend.
I just want to ask Dr. Mukesh if we could give him a chance. Dr. Mukesh, are you trained in Ayurveda? At any point did you receive any training?
No, definitely I was not trained in Ayurveda, but I got trained more than 30 years back. So maybe the things have changed. And if Dr. Prasanna is vouching for it that there is a standard curriculum which is included in the postgraduate training. So I think we have to basically accept the facts and let the government decide and the authorities decide if it is correct, and if they want them to practice. The only thing is that they should not be mixing in the same kind of hospitals. So they should clearly say that this is a Ayurvedic treatment hospital where these surgical procedures are performed. And as I earlier said also, so there should be same law for medical or criminal negligence. They should have a council to deal with this.
They should be equally accountable like allopathy doctors, yes.
Yes, yes.
Sorry for intervene. This negligence rule is common for any practitioners in India. Maybe either Ayurveda or modern medicine. It is common for India. The law of India does not exclude any practitioners.
Okay, okay. Dr. Dilip, I cut you short. You were saying, does it happen now? Dr. Mukesh says he got trained 30 years ago. At that point, there was no Ayurvedic training. Yeah, maybe today things have changed.
Right now, there is no medical college, modern medicine college where they teach Ayurveda.
Okay.
Right? It's a separate science.
I think doctor is not aware of the recent curriculum, competency-based dynamic curriculum implemented by the first time in the NCIS.
That's what I'm saying, sir. Government is trying to integrate these two things, which we are opposing.
It's not integrating. It is an option for MBBS graduate to undergo the internship training in Ayurveda.
Not
Any
MBBS.
selected.
What you are saying is not MBBS doctor, sir. You are training about Ayurvedic doctors who are going to be trained in surgical medicine. Not medicine,
No.
modern medicine doctor.
Ayurveda has a training program of 3 years after graduation course of 5.5 years. It is equal to modern medicine in the term of the curriculum. First
In what
time
way?
in
In what way
India,
they are the
first time
same,
in
sir?
India, National Council Commission of Indian Medicine has introduced competence-based dynamic curriculum. And you go back the date, the National Council of the Medicine has introduced later. Just you see the dates.
That's all I have time for. And from what I gather here, the Ayurveda practice teaches Ayurvedic doctors to perform surgeries. And Dr. Prasanna is vouching for it. He's confident about it, that we've come a long way. India is home to Ayurveda and it's endorsed all over the world. But it does not mix with allopathy whatsoever. And that's what Dr. Dilip also stresses, that it shouldn't be mixed. And I suppose even Dr. Mukesh agrees that there shouldn't be a mix. There should be clear demarcation that this is Ayurvedic treatment that one is receiving, and the doctors are equally responsible as an allopathy doctor when performing surgeries. They all fall under the same guidelines. So as a patient, if I'm aware what I'm getting into, I think that's what matters at the end of it. But Dr. Dilip, all the best for your fight. If you're fighting for Ayurvedic doctors not to be performing surgeries, we'll see how far that goes.
Madam, we are not against Ayurveda.
No, I understand. Yeah.
Clear. But let it be in its pure form.
I think Dilip, Dr. Dilip, you should feel proud that India has contributed Indian system of medicine. Among that, one of the specialties is surgical discipline.
Why are you saying this? We are not objecting to that. We respect that. But keep it in your pure form. Why do you want to enter modern medicine?
No. I totally agree with you, Dr. Dilip, that the medicine which has to be used is only Ayurveda medicine.
Right. You are going to see anesthesia. Are you doing Ayurvedic medicine for anesthesia?
See, anesthesia is developed form of Ayurveda. You go back
answer
to
my
history.
question. Answer my question. Are you going to give Ayurvedic medicine for anesthesia?
Surgeon is not going to give anesthesia. Anesthetist will be going to give anesthesia.
How are you going to operate?
The anesthetist will give the anesthesia.
You don't
Qualified
have answers.
anesthetist will give the anesthesia.
Answers. So, if you are mixing
you can't say that you
anesthesia with
cannot
modern
use
medicine,
gastroscopy or any scopy. In that case, I should say that you cannot use the scopy because the scopy was first introduced by Ayurveda from India. Go back to history.
To know.
That's
interesting to know.
Well,
I think both
by any individual. Any qualified surgeon can use take the help of anesthetist for the anesthetic purpose.
Okay, so we see a lot of it overlapping, and that's why I knew it would be an interesting discussion to have. But I really appreciate Dr. Prasanna, Dr. Dilip, and Dr. Mukesh for joining us. There's still a lot of questions, but hopefully in the days going forward, we'll have a clear demarcation, and this debate would be settled once and for all. But we are certainly, Dr. Prasanna, proud of Ayurveda and how far India has taken it. Thank you.